The gift of vision is something we often take for granted. One of the silent threats to our vision is glaucoma, a condition that can lead to blindness. Glaucoma is the most common cause of permanent blindness worldwide. By learning what causes glaucoma, we can take steps to protect our own vision. The eyes contain a fluid called aqueous humor, which plays a vital role in nourishing eye tissues and maintaining eye pressure. For someone with glaucoma, this fluid either does not drain efficiently, or the drainage canal through which it flows becomes blocked. The increased pressure builds up, which can damage the optic nerve. If the damage continues over time, it may even lead to irreversible vision loss. While glaucoma is often associated with high pressure, it can also occur at normal or low levels of pressure, or be triggered by eye injuries, medical conditions, or certain medications. Risk factors for glaucoma include being over 40, having a family history of the disease, using steroid medications, having vision issues like nearsightedness or farsightedness, and/or having a previous eye injury or surgery. Since glaucoma often develops without symptoms, being aware of your risk factors is crucial. With early detection and appropriate treatment, you can help protect your vision. Concerned about glaucoma? If you're over 40 or at risk, book an eye exam today. Glaucoma is the leading cause of permanent blindness worldwide. With nearly 90% of people living with glaucoma remaining undiagnosed. This is why it's often called the silent thief of sight, because the damage happens gradually and goes unnoticed until it's too late. The only way to diagnose glaucoma is through a thorough eye exam. Your doctor will start by checking the pressure inside your eye with a test called tonometry, because higher pressure can be an early sign of glaucoma. Next, they'll examine the angle where your iris meets your cornea using a test called gonioscopy. This helps to see if the drainage pathway is blocked. A clinical examination of the optic nerve will also be performed to identify any signs of damage. They'll also test your side vision for blind spots with a test known as perimetry. Blind spots can be a warning sign of glaucoma progression. Once glaucoma is suspected or diagnosed, lifelong follow-ups with your doctor are necessary. Early detection and proper care allow you to live well with glaucoma without having to worry about vision loss. If you're over 40 years old or at risk of glaucoma, book an eye exam today. A diagnosis of glaucoma can be concerning, but with advances in treatment, it is possible to manage. Let's explore how. One of the goals of any glaucoma treatment is to lower intraocular pressure, the pressure within the eye. Eye drops are typically the first line of treatment. They either help the fluid in your eye drain better or reduce the amount of fluid produced, thereby lowering intraocular pressure. Less pressure on the optic nerve slows disease progression and helps to prevent vision loss. Different classes of eye drops work in different ways. For instance, prostaglandin analogues mainly enhance fluid outflow, while beta blockers decrease fluid production. Other classes have additional effects, and combination therapies use multiple methods. There are also preservative-free options that offer the same benefits without harsh preservatives. Your doctor will help you determine the best treatment for your specific condition. If eye drops are not effective, laser surgery or traditional surgery might be recommended. No matter what treatment you're on, following your doctor's instructions is crucial for managing glaucoma effectively. Speak to your doctor to find the right glaucoma treatment for you. Prostaglandin analog eye drops are an effective treatment for glaucoma, but like all medications, they can have side effects. The most common is called prostaglandin-associated periorbitopathy syndrome, or PAPS. Nearly half of those using prostaglandin analogs are at risk of developing PAPS, with some medications posing a higher risk than others. Common signs of PAPS include a deepening of the upper eyelid grooves, darkening of the skin around the eyes, loss of fat around the eyes, drooping of the upper eyelids, and excessive eyelash growth. Treating just one eye can also lead to noticeable facial asymmetry. In more extreme situations, PAPS can also impact your quality of life and the effectiveness of glaucoma treatments, including accurate eye pressure measurements and surgical outcomes. If you have concerns or notice any of these signs, talk to your eye doctor. They can suggest alternative treatments tailored to your needs. Ocular surface disease, or OSD, is a condition that affects and damages the surface of the eyes. OSD, often linked to dry eye disease, causes dryness, redness, irritation, burning, and blurred vision. OSD is very common in people with glaucoma, with over half experiencing it in varying severity. The condition can worsen when eye drops are used regularly on an already irritated surface. That's why it's important to find out what factors and which ingredients could be causing the problem. Preservatives in many glaucoma medications, while useful for preventing infections, can sometimes harm the eye's surface, depending on dosage and duration of use. Fortunately, there are preservative-free glaucoma medications available that are worth considering. To avoid OSD risk, the Asia-Pacific Glaucoma Guidelines, APGG, recommends preservative-free eye drops to the following types of patients. OSD can interfere with medication routines, making it difficult to manage glaucoma effectively. This can lead to disease progression, resulting in vision loss, poorer quality of life, and potential surgical complications. However, switching to preservative-free eye drops can improve symptoms and help you stay on track with your treatment. Are you experiencing OSD symptoms? Speak to your eye doctor about alternative treatment options. Being diagnosed with glaucoma and adapting to vision changes can be challenging, especially since glaucoma is a long-term condition that often progresses without symptoms. You might feel that your eye drops aren't making a difference because you don't notice immediate changes, but it's important to remember that these treatments are critical to preserving your vision over time. By staying consistent with your care, you can reduce glaucoma's impact on your daily life. Start by developing key habits that can make living with glaucoma easier. Understanding your medication and how it works is crucial. Follow your doctor's instructions on applying and storing your medication, and always keep your eyes and hands clean when using eye drops to prevent infection. Keep an open line of communication with your doctor about any side effects, and schedule regular checkups to monitor your progress and make necessary adjustments. And don't forget about the importance of overall wellness. Eating a balanced diet, reducing salt and caffeine, regular exercise, maintaining a healthy weight, reducing screen time, and getting restful sleep all contribute to better eye health and overall well-being. Most importantly, stay consistent with your medication routine. Regularly taking your medication is essential to slowing glaucoma's progression. By building consistent habits, managing glaucoma will become as regular as brushing your teeth. And remember, if you don't feel that your medication is fitting into your lifestyle, speak with your doctor about alternatives.